Okay, everyone. Good morning, everyone. The time is now 11:40. This is our first meeting of the SHAC, or the School Health Advisory Council. I know some of you got an email from us in our department for this initial meeting. I'd like to thank you for attending. We're not going to keep you a long time. We understand everybody has things to do. Everybody has jobs, and so you can hope you walked in and grabbed some lunch. Just a little bit of before we get started. Our department has. My name is Bobby Cruz, by the way. I'm sorry. I'm director of athletics for United ISD, and within our department we have the PE and health departments as well. So this year, our superintendent and board of trustees have entrusted us to take over and run the SHAC committee in conjunction with members of our community and parents. And so this is our initial meeting, and we hope that it grows. Over the past few years, we've had a SHAC, but it's gone to different departments, but now our superintendent and board has given it to us. So we'll do a good job with it, and hopefully we'll get a lot of your input, and hopefully we can see each other and bounce off ideas off each other, and hopefully have a good run at this. That being said, before we get started, because I know one of you said, "What am I doing here? What are we going to talk about?" And then I had another person called from Laredo Medical Center, who's Priscilla Salinas, who's out. She'll not be able to attend. She's sick, but she's like, "What is a SHAC and what's it all about?" And we'll get to that in a second. But before that, I'd like to go around and start over here. If you could just please state your name and your title, either administrator or parent or employee.
Yeah, Jay Boteo, UNC athletic coordinator, and I oversee high school health.
Roxanne Robledo, athletic coordinator. I oversee elementary PE.
Jose Briones, athletic coordinator, oversee secondary PE and middle school health.
Marco Garcia, information technology telecommunications specialist.
Hi everyone, Michelle Cantu, elementary school principal at Gutierrez Elementary.
Irene Rosales, Health Services Director.
Cordy Jackson, Director of Purchasing.
Good morning, everyone. My name is Melissa Ramirez, Director for Guidance and Counseling at UIS.
Morning, Jerry Soto, Laredo Fire Department Program Coordinator for the Opioid Response Team.
Good morning, Ray Soto, parent of Jerry Soto.
And Minerva Soto, I'm a parent and his mom.
Nice.
Good morning, Angelica Magaña, Angie. I'm a parent of a student at United South High School.
Thank you.
Adriana Cardenas, I'm a parent of a student at United South High School. I'm also an administrator there as the instructional coordinator, so glad to be here.
Good morning, I'm Monica Viales, Kinder ELAR coordinator with Curriculum and Instruction.
Buenos días, soy Gloria Pliego y soy una madre de familia de una niña en Borges.
Good morning, I'm Courtney Sarabia. I'm the Employee Wellness Coordinator and I'm also a parent of 2 girls at Colonel Santos.
Buenos días, Yesenia Castillo, soy madre de familia de una niña en United South High School y una niña en Antonio González Middle School.
Good morning, Jessica Escamilla. I'm a parent for my daughter at Bonnie Elementary.
Good morning, everyone. Rebecca Morales, Executive Director of Federal and State Programs.
Good morning, I'm Mariana Valdez. I'm the Operations Manager for the Child Nutrition Department, and I have 3 boys at Alexander High School.
Hi, good morning. I'm Alonso Valino, Sergeant with the UIC Police. I got 2 daughters.
Good morning, Annette Perez, Director for Discipline Management and Student Relations. Welcome.
Good morning, I'm Michelle Barrera, Procurement Officer for the Purchasing Department under Ms. Jackson.
Well, thank you all for being here, for accepting this invitation to be a part of our committee. I would like to single out. She's already introduced herself, Ms. Roxanne Robledo, who's our athletics coordinator. She's in charge of a lot of stuff, but she'll be co-chair for this committee as well. As we get started, I would just like to go over why we're here and what the SHAC is supposed to do. So SHAC stands for School Health Advisory Council. And children and youth who begin each day as healthy individuals can learn more effectively and are more likely to complete their education. The responsibility for the physical, emotional, social, mental, and intellectual health of our kids belongs to our families, to us, and the entire community. Effective coordinated school health programs can contribute to helping young people avoid health risks by increasing their skills to make responsible choices about the behaviors and the choices that they make that can affect their health. UISD has established an advisory council to advise our school board and our superintendent. It will assist the district in ensuring that local community values are reflected in the district's health education plan. This council will advise and support the school's efforts, or the district's efforts, to assess their needs. It will also design programs to help children develop the knowledge, skills, and attitude they need to become healthy, productive citizens. A SHAC committee is appointed by the school district to serve at the district level and to provide guidance to the district on coordinated school health programming and its impact on student health and learning. So what are the duties of the SHAC? What are our duties and responsibilities? As a member of the SHAC, you'll be involved in discussions and recommendations about topics such as school nutrition, which is why Ms. Ari, as Ms. Valdez has been invited, physical fitness and activity, which is why we have these coordinators over here that oversee our PE department and our health curriculum. Bullying prevention, where it's Ms. Annette Perez. Suicide prevention as well. Suicide prevention was our Director of Guidance and Counseling. Physical health concerns, substance abuse prevention, counseling programs available to our students, promoting a safe and healthy learning environment for all students, and any strategies to increase parental involvement for our kids. What are the membership requirements of the SHAC? The Board of Trustees and the superintendent or the designee, they can appoint 5 members, at least 5 members. You're looking at one of them that was appointed. And then I think you got, those that got an email that are administrators, you were appointed as well. Everyone else is here as an invitation, and hopefully you stay as a part of our committee. We're not finished. We're gonna continue to send out invitations to other parents. A majority of the members of the SHAC must be persons who are parents of students enrolled in the district, which most of us are. The Board of Trustees may also appoint one or more persons from each of the following groups to have a wide representation on our committee. They can include classroom teachers, school counselors, administrators, students, and we are going to invite at least 2 students from each high school for our next meeting. And then hopefully they can stay on, and I'd like to invite either sophomores or juniors so they can stay with us for 2 years. Healthcare professionals licensed or certified to practice in this state. I did invite Dr. Christian Cabello, who's a dentist, and I invited Dr. John Puig, but they both had other commitments today, so hopefully they'll join us on the next one. The business community, law enforcement, which is why we have Mr. Galindo here, and Mr. Soto, thank you for joining. Hopefully you can become a member of our SHAC and visit, and if not, that's okay. We'll ask Chief Hurd if he can send somebody, unless you want to volunteer. The clergy, nonprofit health organizations, senior citizens, I already said that one, and local domestic violence programs. Just a few. So as you can see, it's a cross section of our community that can be involved in our SHAC committee. SHAC committees are required to meet 4 times per year. This first meeting is an introductory one, an organizational one, just to tell you what we're about, what we're trying to do, some topics of discussion. Once we have your information and your emails, we will send you possible topics of discussion, or you all can give us your input on things that are going on at your campus or things that you're seeing at home or in the community that we need to bring up and possibly address to our superintendent and our school board. And our role is not to create policy, but to recommend. Our next meeting, since November and December are going to fly fast, our next meeting will probably be sometime in mid-January. Then our meeting number 3 will be in March. And then meeting number 4 will be in probably mid to early May. And then I'll have to meet with our board and report to them about what happened what the SHAC did this year. That being said, trying to be as brief as possible. Does anyone have any questions so far? Anything? Okay. Our next presenter is when trying to develop the agenda for this first meeting. We always have to introduce ourselves and set up the organization, tell you what we're about, and try to be brief with at least 2 or 3 topics. Today, the first topic was about the SHAC and its organization. Our second topic today is what we've been seeing as administrators, and what we've been warned about is the use of illicit fentanyl in our schools, and we're having a lot of issues with that. I know in athletics we're seeing some of that. It's more on the vaping that's really prevalent, and hopefully at the next meeting we'll have another presentation on vaping as well. But what we're seeing an uptick on is the use of fentanyl, and how we're battling that through the help of Ms. Annette Perez and Ms. Ramirez. Is our fire departments are going to our campuses, our middle schools, high schools, and explaining to our kids the dangers of it, and just to reduce the risk of usage. So with that being said, I'd like to turn it over for a little bit to Mr. Soto from the Laredo Fire Department.
Don't be shy, you can applaud louder. Thank you. So, my name's Jerry Soto. I'm the program coordinator for the City of Laredo Fire Department for the opioid response program. I'm a firefighter paramedic. I got my master's of science in nursing, and I'm also a registered nurse. By show of hands, how many of you know what an opioid is? I'm not gonna pick on you. Don't worry. By show of hands, how many of you know what fentanyl is? Good. For those that do not know, let me explain it to you. So, an opioid, does this work? Does this work? You guys can hear me, right?
Yes.
Yeah, okay, great. So, that's an opioid. It's a class of drugs that mimic substances found in the opium poppy plant. It does come from a plant. Chemists, scientists make those derivatives, and they were able to make different types of analogs for pain killers, such as morphine, heroin, codeine, oxycodone, hydrocodone, and fentanyl. The killer being fentanyl. So it does come from a poppy plant, but like I said, chemists and scientists were able to derive those chemicals and make all these other types of drugs. Now we know them as opiates, painkillers, or narcotics. How do they work? Well, they work by activating nerve cells in the brain called opioid receptors that block the pain signals between the brain and the body. There you go, blocks the pain signals. That's why they're called painkillers. So a person using opioids can develop a tolerance, physical dependence with the risk of overdose and death. Now that we know what an opioid is, and now we're going to talk about the dangers of fentanyl. So what is fentanyl? Fentanyl is a 100% synthetic opioid. It's made in a lab. It's a white powdery substance. And with that substance, it's tasteless and it's odorless. So you can't say like, oh, that is fentanyl. You need special lab equipment in order to test it. There are specialized test strips that you could buy online for that, and it'll test that drug with probably like a 98% accurate reading on fentanyl. I want to give you some important statistics. Opioids can lead to physical dependence within 4 to 8 weeks. And about 45% of those people who use heroin started with an addiction to prescription opioids. That's how it starts. And in 2020, about 902,000 people reported using heroin in the past 12 months. These statistics, to me, when I saw them, I couldn't believe it. From 2015 to 2021, fentanyl deaths in Texas increased by 670%. 107,000 Americans died of a drug overdose, and 71,000 were related to synthetic opioids, such as fentanyl, heroin, methadone, any type of opioid. Illicit fentanyl overdoses are now the #1 cause of death among adults 18 to 45, more than COVID-19, cancer, heart disease, and all other accidents. I had to research that a couple of times because I couldn't believe that. I couldn't. The #1 cause of death being illicit fentanyl. That's amazing. That number shouldn't even be there. In Laredo so far, 2021, we had 344 overdoses. 52% of those were opioid related. This year, we haven't even finished out the year, and I just got those numbers 2 weeks ago. 325 overdoses, 58% opioid related. I can tell you that in 2020, we had 48% opioid related calls leading to overdose. 10% in 2 years. That's a lot. That's too many. I want to give you guys another statistic, a statistic that was told to me by the police department. Last year, we had 16 deaths due to fentanyl. This year, we're up to 35 already. That's double. And so we sounded the alarm saying, you know what, there's a crisis here in Laredo because of that. And what better way than to use prevention? Let me give you some facts about fentanyl. 50 times stronger than heroin and 100 times stronger than morphine. Maybe some of you already had surgery, some of you have already been, getting morphine at the hospital. Imagine something being 100 times stronger than that. Now, let me just go ahead and tell you this, that fentanyl, there's 2 forms of it. The illicit kind, which is the one I'm talking about, and then there's a pharmaceutical kind. The pharmaceutical kind, the one that doctor prescribes to you, is either given in a throat lozenge, a patch, or it's given through the IV at the hospital. That's it. The doctor's not going to give you a pill of fentanyl. The doctor's not going to give you a white powdery substance so you can mix it in. No. It's only in those 3 forms. But they're very specific. They have specific clinical guidance on when to give it. They're only given post-surgery and for advanced cancer. I want to show you a graphic, not a graphic picture. It shows you the fatal dose of fentanyl on a penny. That's 12 to 15 grains of salt. That's on a penny. That's enough to kill anyone here in this room. The strongest opioid right now is called carfentanil. and that's an elephant tranquilizer. 2 to 3 grains of that is enough to kill anyone in this room. Just so you can see what a fatal dose of fentanyl can do. So the big rage a couple of months ago, actually last month, was rainbow fentanyl. The DEA came out with a warning saying hey, they're targeting our kids and things like that. Well, New York had a bust. And this drug bust, they found over 3,000 pills hidden inside Skittles, Nerds, Sweet Tarts, and Whopper boxes. They weren't trying to target the kids. What they were trying to do was hide those drugs from the authorities. They didn't want to get busted, but they did. New York sent all those pills to the laboratory. 100% came out with fentanyl. 1,500 of those pills had that fatal dose. So imagine that, bringing that to a school. You don't know. Now the big awareness that the DA is doing is one pill can kill. That's exactly right. They don't know which pill they're gonna get. They can tell one friend, hey, I took it, I'm fine. That next pill might not work that way. Oh, and if you saw that, rainbow fentanyl has already been found in 26 states. That's the latest from October, and it's been found in Texas already. But why rainbow fentanyl? Why those colors?
They attract kids. They
That,
attract kids.
that, and also, grandparents, parents, vitamins, do they all have the same shape? No. My grandmother takes, and my mom takes a lot of different kinds of pills with different colors. Different colors, different pills, and some hydrocodones are yellow, some other pills are blue. So what the drug traffickers are trying to do now is make those look like the authentic kind of pills, but they lace them with fentanyl. So what's the big issue right now? It's not that I can go and straight up buy fentanyl, go to a drug dealer and say, hey, I just want fentanyl. No. What they're doing is they're lacing it to everything. Up north, they already found fentanyl in Vegas. It's being mixed in heroin, being mixed in cocaine, amphetamines, Xanax bars, ecstasy, anything you can think of, it's being mixed in. And why is that? Fentanyl is very cheap to make. Like I said, it's 100% synthetic. Just buy a couple of powders, mix it, and that's it. You can start making your pills. Very cheap to make. What you think you're buying cocaine is no longer 100% cocaine. You always hear about being mixed with some other kind of stuff in there to make more profit. Well, now it's being laced with fentanyl. To tell you guys a story, this couple, known to law enforcement as being cocaine users, did cocaine one day, partying, both of them did. He died. She made it. Laced with fentanyl. What are our public health concerns? What are the concerns that each one of you has right now? The concerns are this. Dealers are shaping and coloring pills to look like fentanyl-free opioids from a pharmacy. So what you think might be buying a hydrocodone because it has a nice little 10 on there, it has that little butterfly, whatever it is that's on there, they're shaping it to make it look like that. You're buying that illegally, and it might have that fatal dose in there. Remember those 12 to 15 grains of salt could be inside that pill. That's why it's so dangerous now that the drug dealers are doing that. And they're targeting their young people by using social media. One parent told me that she went into her daughter's Snapchat and she saw this guy selling a bunch of vapes, $50. Within 15 minutes, sold out. Of course, she reported it, But those are the things, that's how they're being targeted right now. That's what they use, social media, and those are the biggest concerns. College people, high school, even middle schoolers can run across these illegal drug sales through social media. The evidence-based care to treat those people that use these kinds of drugs. This is evidence-based care, so each one gets a personalized diagnosis and treatment planning. There's long-term outpatient care, access to FDA-approved medication. There's only 3 medications. Methadone, maybe you guys have heard of methadone, buprenorphine, which is Suboxone, and naltrexone. All these 3 medications can be prescribed by a doctor. Behavioral interventions delivered by trained professionals, and coordinated care for addiction and other conditions. Recovery support services such as mutual aid groups, peer support, and community services. SCAN, think of SCAN, think of Pillar, think of Border Region. There's also 100% online resources now, 100% online, that they do telehealth visits and they get their medication sent to their local pharmacy so they can go pick it up, such as the buprenorphine. And what are we doing as your City of Laredo Fire Department to combat this crisis that's going on right now? What we started to do is, like he had mentioned, we're going out to the high schools now, and we're giving them presentations. These presentations involved us doing what is an opioid. We also show celebrity pictures. Pictures of celebrities who have died from a drug overdose. So they can see and say like, wait a minute, they're rich and famous. They're also dying because of this. We also do, as you can see on that first picture, a scenario of an overdose victim. And we put a student and pretend that he's dead. We go through the full motion of what our paramedics deal with out on the scene for an overdose victim. So we put the IV on, we pretend we're giving them Narcan, and the patient comes out very aggressive, just like they really do out on scene. And that's what we do for the kids, so they can have an impact and a lasting impression. What we do as the opioid response team is post 911. So after a person has an overdose and he refuses to go to the hospital, our team goes out there and teaches the family members how to use this life-saving medication called Narcan. That reverses opioid overdoses. It does not reverse any type of other overdose. It won't reverse alcohol, cocaine, methamphetamine, or any other drug, just opioids, heroin, fentanyl, things of that nature. Now let me tell you something else about fentanyl, and that's why we're here, is that whenever someone takes fentanyl, it's a very strong medication, as you saw. It's 50 times stronger than heroin. That only lasts 3 to 5 minutes in my body. So what happens when it wears off? I go back into an overdose again. And so that's what we're seeing out there on scene. That's what we're seeing out on calls. It used to be when I was on the ambulance, we carried 2 milligrams of Narcan. All I had to do was give 0.4 milligrams, which is not even half, and they would come out. Now, paramedic is giving up to 12 milligrams of Narcan out on scene through the vein in order to make him survive. So now we know there's a change of drug out there. There's something that's amiss. This drug is more powerful, more addictive, and it's very lethal. Once we teach the patients how to use Narcan, we also teach them how to do CPR on scene. We teach them the signs and symptoms of an overdose. And also give them a fentanyl test strip. So this test strip tests the drugs, the residue of the drugs for fentanyl. They can also test urine. Okay? This you can find on Amazon for $2. So for anyone who's interested in buying those, you can buy them. So we got a grant through the federal government. Our grant does not permit us to buy a fentanyl test strip. So we got private donations from our local Laredo Rotary to buy these for us. And this is the kind of training that we provide to the people out there. I can pass one along to you. It has a simple QR code and it tells you how to do the testing. As I mentioned before, we hook them up to the treatment being Pillar, Scan, and Border Region and our local methadone clinic. We give them the flyer that has all our numbers and the websites that they could go to. I want to give you guys some information that's very detrimental to this presentation that I'm giving to you right now, and why I mentioned the dangers of fentanyl. Since late July, Ms. Ramirez has mentioned it at other presentations of ours. Now it's 4. Used to be 3. Now it's 4. From Hays County. That's over there by San Marcos. 4 kids have already died due to fentanyl overdose. How? Well, they busted the guys who did it. A 20-year-old and a 16-year-old. What were they doing? Selling fake Percocets. What did I just mention? They're trying to make it look like the real thing. So they were telling kids, this is the real thing. Look, it's a real Percocet. Perfect. Someone would buy, and guess what? One friend said, hey, I took it, I'm good. It feels good, good. He buys one. He died. Another kid buys some, keeps going like that. Guess what? Another guy buys one. He died. Guess what the youngest age was? 15. Sophomore. 15 years old. What I like to ask the students, so the way the fire department works is we go in at 8 o'clock in the morning and we don't get out till the next day at 8 o'clock in the morning. So if I go on shift today, guess what? I'm not coming out till 8 o'clock the next day. I'm sure you've seen our ambulances behind your cars. You guys never move out of the way, right? That's you. Yeah, we know you. So anyways, those, how many times do you think our ambulances go out in one full day? Not just one station, but all of them together. Some of the kids have pretty good guesses, 70, 80 times. We actually go out 100 times per day. Over 100 times. And out of those 100 times, we get one overdose daily. Whether it be alcohol, cocaine, or some other type of drug. But 60% of those, we're gonna run into an overdose for opioids. I had a presentation just this morning over at the Alexander 9. One of the paramedics told me that he just got off his shift and 30-year-old female died of a heroin overdose. Just this morning. The local fentanyl deaths. Last year we had 16. This year we've already doubled, we're up to 35. The youngest death right now being 17 years old. Out of the calls that we've had that we give Narcan to through the IV, the youngest person we've had is 17 years old also. What are we getting as feedback from the students during our presentations? One student came up to us and said, sir, can your team come out? My brother's in jail. And he's about to come out. I want you to teach me and my mom how to use this. I'm sorry I get very passionate about this, and it's so sad to hear about these kids knowing that they can do that. What is the other feedback from the students? Well, when we do a student that pretend that he's dead, what happens is they see that student that's there. We have an actress portray that's the mom. They tell us, you know what, I never want to see my parents like that. I never want to see my mom like that. I spoke to you about Narcan. With Narcan, anyone here can order free Narcan. Just go to morenarcanplease.com. They'll send it to you for free. Anyone here. If you're interested in carrying Narcan in your vehicle, have it on your purse, have it with you in person, you can go to that website and they'll give you one for free. Any questions that you may have right now?
Sir, so you're going out to the high schools right now?
Yes.
Are you doing middle schools as well, by any chance?
Middle school's not right now. The only reason is the age group that we've seen so far that have been taking these drugs is 16 and above, which is high school students. That's what we're trying to hit, because those are the students that are more impressionable. They have that invincibility syndrome. They think they're very invincible to everything that they can do. We just try to portray them like one pill can kill. Yes, ma'am.
So, I know that you said about middle school. If I'm not mistaken, that's kind of when they start trying, experimenting with vaping too. And if you're saying that now they're putting it in everything, like, it could be a chance that a child thought they bought like a regular vape and then, right, it's laced and then.
That's correct.
Because I know that when my kids were in middle school, they said that a lot of kids would talk about vaping.
That's very true, yes. 80% of the STEM kids are there for vaping. Yes.
I want to mention that they actually did this presentation for our parents at the Parent Learning Summit that we had at United High School on November the 5th. And after we went back and looked at all the attendance reports for all of the sessions, this was the most attended English session. So the parents want to know more about this crisis that we're in. So
Yes. The reason we talk about so much fentanyl, it's here in Laredo. Our paramedics have run into it. We went to a death call at Motel 6. The guy thought he was doing cocaine. Laced with fentanyl. Automatically died within 30 seconds. So the housekeeper found him like that. And it's unfortunate. Yes, ma'am.
I just wanted to add, Adi, we have 4 licensed chemical dependency counselors, each feeder pattern, so they are talking to our middle school students about this and the dangers of vaping as well.
Thank you, everyone, for your time. Thank you for listening to me. And if there's any questions that you want to ask me individually, I'm here for you. Thank you so much. Thank you.
Thank you for that information, Mr. Soto.
Mr. Soto.
You know, for the parents that are here today, I know we're all parents at one point or another within our district, but as administrators, we know the services that our discipline provides, that our nutrition provides, that our counseling provides, but this is very important and informational for our parents who do not work within the district. And the goal of this SHAC is, as we get started and move forward, I know this is our first meeting that now that we're taking over, is to get more parents involved that are not employees of the district, and at the same time to get students involved, because we do have to have students on this committee. With that being said, I appreciate you being here, Mr. Soto, and hopefully you'll join us for more meetings as a part of our law enforcement and fire departments. Our next one, our last presentation, will be a brief one. Our goal was to get everybody out of here by 12:30. I know we said 11:30 to 1, but I gave us a 30-minute wiggle room so y'all can enjoy your lunch. Our next person is our Director of Guidance and Counseling, and she's going to speak to us today about services that are provided and a presentation that is upcoming that we can take advantage of. Ms. Melissa Ramirez.
Good morning. Does this work, or is it that?
Good morning. Thank you so much. And I do want to thank Mr. Soto, the fire department, and the Laredo Health Department because they did have a meeting with us as well as with LISD. And we came together to start spreading the news about fentanyl awareness, and we created a PSA. You will see that PSA up on the Jumbotron when you are going and you attend football games, and they're also going to be doing those as commercials on KGNS. So it is a citywide effort, and we're all working together and joining forces. In the Guidance and Counseling Department, we're very fortunate to have an MOU, which is a Memorandum of Understanding, with the University of Texas in Rio Grande Valley, UTRGV. We have telehealth, it's called TChat, and we have that at every single campus. So before I talk about this flyer, I want to talk about TChat. It wasn't on the agenda, but I want to just let you guys know that TChat has been onboarded at every campus, elementary, middle, and high school. And that is telehealth, and that service is being provided on the campus. All of the faculty and staff had to get trained first through UTRGV, and then they do the referral process to the counselors. The counselors get the referral, they send in the paperwork, and the students will be seen on campus telehealth. And we are very fortunate to be able to have that service here in Laredo because locally we are short in services. And the Board of HMR, Pillar, everyone is already inundated. And our counselors, when they were referring to the outside agencies, parents had to wait 2 or 3 months. So now with TChat, and it's on every campus, the students and parents don't have to wait that long for that particular service. Since we do have that Memorandum of Understanding, there's also some parent mental health sessions that we were able to provide for the parents in our district. And we were able to go ahead and solidify that for the school year. So we started on September the 7th with stress and coping skills. And these presentations are all done by faculty at UTRGV. So they are professionals. They're either medical doctors, they're licensed chemical dependency counselors, there's licensed social workers, or licensed professional counselors, or medical doctors. So this morning, actually, we had one on stress relief and self-care, and then our next one is going to be on anxiety and depression in children and adolescents. This does go out on Parent Square, and all of our counselors in every campus sends it out as well to their parents to be able to provide this service. This service is done virtually, and we are also recording the sessions, and we're putting it up on our Guidance and Counseling website in the event that the parents cannot attend. I know that I've been asked, can you change the time? Can you change the language? And I can't do anything about that because it is a service that UTRGV is providing us. And it is a service that we had to adhere to their presenters and the time that they're available. So those are being recorded and they are being uploaded in the Guidance and Counseling website. Okay? Any questions regarding the services? The other thing I do want to mention, just to kind of piggyback on what Mr. Soto was saying, we do have 4 licensed chemical dependency counselors in the district. It's 1 per feeder pattern. And we also have on the Guidance and Counseling website, if you click on the right-hand side, you'll see licensed chemical dependency counselor, and there's also a resource. When you click on that, there's a landing page with a lot of information for parents and students regarding drugs, marijuana, whatever the case may be. And we'll also have that flyer that Mr. Soto has been introducing to the students at the campuses. And I do want to say, I traveled with them over to STEP Academy and to LBJ, and the students are extremely, extremely interested in the information. We do have problems with vaping, and that's no secret. We are working on that. Students don't understand the dangers that come with it because, like Mr. Soto said, it could be laced with fentanyl. So when they do the whole enactment of a child being overdosing and then one surviving, It's very impactful to the students, and a lot of the students come up after, and they will ask the fire department for information. Sometimes they're asking, like Mr. Soto mentioned, for a brother or sister, and sometimes it's for their parents, you know. And I also meet with our licensed chemical dependency counselors every week just to find out what's going on, how we can create awareness for our students, what other things do we need to work on in our district to make sure that we create that awareness to the students about the dangers of any drug. And so I'm real grateful for the service that they are providing our school district. Okay. Any questions? All right, thank you.
Okay, thank you, everyone. Just in closing, I appreciate everyone being here for our initial SHAC meeting. Like I said, it's our first one. I'll be honest with you, it's going to be a work in progress. We're gonna do the best we can and try and make it a good, effective SHAC. Parents, we do need your input on what you're seeing at home or topics of discussion. Now, the SHAC is not a committee where we're going to come and complain, el coach no está jugando a mi hijo. That's not the purpose of the SHAC. The purpose of the SHAC is, and I'll give you an example, last year, our health and PE department had to implement, through a new Senate bill, we had to implement a human sexuality curriculum. And there was a lot of misconception on what exactly we were going to be teaching. And so the SHAC committee got together and we had to present to our parents and also our administrators who are parents. But if you don't work within the district, you really don't know about it. So we have to make sure that we inform our parents and our community exactly what we will be teaching in our curriculum, and that it reflects our values as a community. And so there was a lot of misconception on it last year as to what exactly we're going to be teaching and why and this and that. But I think our SHAC did an effective job of letting everyone know that whether you live in Laredo, San Antonio, Amarillo, Brownsville, Houston, or El Paso, we had to teach these lessons. And so at our next meeting, that's one of the things that we're going to discuss is an update on how that curriculum is going. In closing, before we adjourn, we do have your email, your information. We'll be sending out items to you, like the flyer for that Ms. Ramirez just presented. We do have to record these. I'm going to update our SHAC webpage on our district so our parents can go on there. Ms. Robledo and I are going to put up an application and blast it out to our campuses. And so our administrators and principals can give it to their parents, and they can apply to be on the SHAC committee. We don't want it to be too large. Other districts have 20 people on their SHAC. Other districts have 75 people on their SHAC. This is a great start for us, I think. I appreciate your time for being here. Hope everybody got some lunch. And are there any questions in closing before we adjourn?
Coach.
Mine.
What you were saying, what you presented to the students, like, was it all grade levels or just the high schoolers? Gender, the sexuality?
All levels.
All levels.
It starts with our first lesson in first grade. It's one lesson for first grade.
And you started that last year?
Yes.
We started it
This year.
School year.
And all lessons are age appropriate.
Thank you.
On our website, we do have to on our webpage we do have to post the agenda, the invitation. We do have to post our minutes, and we do have to post the video, which is why you see ITV here, and to cover this meeting. That being said, I appreciate your time. Before we leave, we'd like to give you all a little something just a little goodie bag. So if you got a ticket, look at your ticket. I didn't get a ticket.
Yeah, I didn't get one.
Please don't be mad at me if I don't pick yours, okay? I'm sorry.
Move it, move it.
We didn't even turn it.
There you go.
She's already gonna go get it.
Ora. Where's the winner?
Ticket number, last three numbers are B-O-B, Bob? That's me. 854.
854.
Spurs ticket or?
2289854. Goodie bag number 2 goes to 848. 848.
Not here. Not here.
All right. And the last goodie bag goes to 851.
She's gonna give away her prize.
Nice, thank you. Thank you. Again, thank you all for joining us for this meeting. If there are no questions, we're adjourned.